Hi, everyone. My name is Michelle,
My name is Shaira.
and today we're going to be discussing medication safety and vaccinations for older adults. Shaira and myself are in our last year of pharmacy school at MCPHS University, and currently we're doing a rotation at Pharmacy Outreach. So what is Pharmacy Outreach? It is a program that provides free information and referral service to help people take medications appropriately. It helps by helping people to obtain and afford medications and also to understand their medication. It is funded by these four organizations, including the MCPHS University. So how do you connect with Pharmacy Outreach? You can either call their toll-free line, you can visit them on the website, or at outreach events throughout the state. Right now, the events are on hold due to the coronavirus outbreak, but Pharmacy Outreach is staffed by case managers, pharmacists, and pharmacy students. So what do? We answer questions about medications and diseases. We provide one-to-one medication reviews. We research ways to save on the cost of medication. We also help to evaluate insurance plans, including Medicare Part D, for the most cost-effective options. Excuse me, sorry for my screen. We also help to educate at community events on many health and prescription assistant topics. As far as the objectives for today, we hope that you're able to learn some simple tools to help you manage your medication and their costs. And we hope that you're able to understand the importance of vaccinations for your age group. Now we're going to go over some programs that help with medication costs. So Medicare Part D is prescription drug coverage under Medicare for individuals who are over 65 years old or those who are under 65 collecting disability. It is provided by private insurance companies, it covers prescription brands and generic medication, as well as syringes used to inject insulin and the Shingles vaccination. So how we help with Medicare Part D, we help by finding the most cost-effective plans for the medications you take. We help to find lower cost medications on plan, and we help with cost of medications in the deductible coverage gap or medications that are not covered. Another program is called Prescription Advantage, which is a state-sponsored prescription insurance plan. It is a secondary payer to Medicare Part D. It helps by filling in the donut hole, so it offers medications at a co-payment price. It's free for most people. It has its income limits for single and married at $84,550. You can enroll by calling this toll-free number that is on the screen. So now we're going to be talking about avoiding over-medication and harmful drug reactions. This can be achieved by keeping an updated drug list, be aware of over-the-counter medications. For example, your doctor might prescribe you a pain medication called naproxen. Naproxen is the generic for the OTC medication named Aleve. So if you're taking naproxen and Aleve at the same time, you're basically taking a higher dose than what you should be taking. It's important that you ask questions, follow directions, and report any problems right away. So we're also going to go over taking your medication safely. So it's important to use one pharmacy. double check the label and contents of the bottle. So you can use a magnifying glass, and you can also use a pill organizer to organize your pills and make sure that you're not, that you're actually taking the prescription as you should be taken. Never take the medication in the dark because you want to make sure that you know what you're taking, and never share medications. Although your friends or a family member may have the same medication that you're currently taking, it could be a different dose, and that is extremely dangerous. As far as the medication checkup, you want to make sure that you're always asking your physician, your local pharmacist, or even us here at the pharmacy outreach program any questions that you may have. You want to make sure that you clean out your medication cabinet regularly, so any expired or unused medications. Want to make sure that you're getting rid of those. And we will talk about how to properly dispose that in the upcoming slides. Storing medications properly can be achieved by storing medications in a cool, dry area. We want to avoid any humid areas such as the bathroom or even a small kitchen. An example of a medication that you want to make sure that you're storing in this cool, dry area would be nitroglycerin. Nitroglycerin is a medication used for chest pain. Usually, should be stored in a little dark colored glass bottle. And that's a medication that can be affected by the humidity. So it is important to keep that away from anything that has moisture. We want to make sure that we're keeping all medicines out of sight and reach of children. We want to make sure that we store pet medications separately, and that is to not confuse the medications that you're taking along with your pet's medications. As far as theft risk, in order to decrease that, you want to make sure that you're keeping your pocketbook next to you, not away from you, out of your sight. And you want to reduce the visitors to your home. And mainly when I say visitors, it's mainly people that you don't know well. You don't know them well or the intentions that they may have. As far as tablet splitting, if the FDA approved your tablet to be split, the tablet will be scored, just like it is here in this image. Only split the tablet when it is intended to be used. So split tablets may be affected by factors such as heat, humidity, or any moisture content. Most sustained, controlled, or time-release medications should not be split. For proper medication disposal, we want to make sure that we're preventing pollution, any poisoning, any drug abuse. The police department usually has a prescription drug drop box that you can properly dispose of your medication. I would check with your local police department. The DEA also has National Prescription Take Back Day. We just had one October 24th, I believe. Yes, October 24th. That was 2 days ago. And just want to check on their DEA website for the next upcoming National Prescription Take Back Day. Now we will hand it over to Shaira.
Hi, everyone. All right, so we are going to be talking about those medications that should be used with caution. We're going to talk about the Enzymes, also known as non-steroidal anti-inflammatory drugs. These are the ones that are to reduce the pain and inflammation. These are basically your typical painkillers, as you may see in the image. And the reason why this should be used with caution is because these can increase the risk of bleeding, stomach ulcers. They can also increase blood pressure and affect your kidneys and make heart failure worse. There's also some certain diabetes drugs that we want to keep our eye on. Some of them are glyburide or chlorpropamide. And these can cause dangerously low blood sugars. And you'll see some symptoms such as shakiness or dizziness, headache, fast pounding heart rate, or some sweating or cold, clammy skin. Additional to these, we have the medications used for anxiety and or insomnia. Some of them called Valium, Xanax, Ambien. And the reason of this is because they increase the risk of falls as well as confusion. They stay for a long time in your body, and thus the effects can carry into the day even after you take the medication. You certainly want to make sure that you're keeping your eye as well on those over-the-counter products, such as Benadryl. These, again, are medications, of course, that are sold without a prescription, and they are not risk-free. The thing about those over-the-counter medications is that they have diphenhydramine, and this is an ingredient that you will see in any medications that has the PM written on it. And the symptoms that it causes is that it would be confusion, blurred vision, and this ultimately increases your risk of falls. We also have some medications called PPIs, also known as proton pump inhibitors. They're basically the ones that lower the amount of acid in the stomach. So they treat heartburn or the GERD and ulcers. You can see some of the examples, Prilosec, which is omeprazole, and Prevacid, which is lansoprazole. The safety issue for this is that really they're pretty much safe. The only important thing is that you must follow the instructions. You want to take them 30 to 60 minutes before breakfast. And can I stop them? You must slowly decrease the use over a week or more. It is very important to do this. This is, again, going back to following the instructions. And you may use Pepcid and cimetidine instead of any of the other products. For calcium and vitamin D, these are good for strong bones, nerves, muscles, and blood vessels. Vitamin D helps the body absorb the calcium. This is why we consume them together. Something very important is that vitamin and calcium supplements have been shown to reduce the risk of bone loss and fractures in older adults. Again, another reason why it's so important to take them. How much do I take and when? You want to take twice a day with meals. And there's two types of calciums out there that are pretty common to use, but you want to make sure if you're choosing between calcium carbonate and calcium citrate. The reason being is that people with low levels of gastric acid, which is something that is very common in people over the age of 50, is that they absorb calcium citrate more easily than calcium carbonate. So you want to keep that in mind when the time comes to choose between one and the other. Now, either vitamin D2 or vitamin D3 can be used. Now, moving from the medications to vaccine, let's start talking about the influenza, also known as the flu. So what is the flu? This is basically something caused by various strains of the influenza virus. This can cause mild to severe illnesses that can lead to hospitalizations. How can you prevent it? You need that annual vaccine, and you also need that personal hygiene. When I say personal hygiene, I just mean those preventative measures that we've become so familiar with, during this pandemic with the COVID-19. So that is, washing your hands appropriately, cleaning any surface areas, being careful when you're coughing, and much more. Signs and symptoms include sore throat, dry cough, runny nose, fever, chills, and headaches. For the vaccine, who can get it is that all adults over the age of 65 must get the high dose. And the reason being is that, of course, as we age, our immune system ages as well. So we want to have the most coverage as possible. So this is why a high dose is the best option for the geriatrics. If by any chance your pharmacy doesn't have it in stock, it is okay to get the regular dose. However, again, it is better to get the high dose. When do you get it is every year, and the side effects include the pain and swelling at the injection site, a fever, and fatigue. So now we're going to see the vaccines for pneumonia, but let's just go ahead and talk a little bit about what it is. So this is an infection in the lungs caused by bacteria, virus, or fungi that you can catch anytime, anywhere. If you want to prevent it, is again, you need to get vaccinated, and you should just do personal hygiene and those healthy choices. When you have pneumonia, you may experience some, but not necessarily all of the following symptoms. You can have fever and chills, difficulty breathing, the coughing, extreme exhaustion, increased sleepiness, confusion, and urinary incontinence in geriatrics. You could have sweating and some yellow, greenish, or in rare cases, bloody mucus when you're coughing. For the vaccines, there are two types. There's the Prevnar 13 and the Pneumovax 23. Who can get it is all adults over the age of 65, and the side effects just simply include redness, pain, muscle aches, and fever. It is important to mention that this is not a vaccine that you need to take yearly like the flu vaccine. And it is also important that if you have any questions about this vaccine, you should go to your primary doctor or your local pharmacist to see not only about your history, your medical history, but also to see what is the best option for you and which is the best vaccine to start with. Now, last but not least, let's talk about the shingles vaccine. But before we head into that, let's talk about what is the shingles. So this is an infection caused by the varicella zoster virus. It's the same virus that causes the chickenpox. Now, after a person recovers from the chickenpox, the virus basically stays inactive in the body. And this can reactivate years later, which is why it causes the shingles. Like I mentioned before, as we age, our immune system ages as well. So it's not going to be able to fight it off as it may have done when we were younger. So a viral infection, this viral infection is going to cause a painful rash, as you may see in the image. And the best way and only way to prevent it is by getting vaccinated. The signs and symptoms, it includes the pain, burning, numbness, or tingling at the area where the rash is gonna appear. There's gonna be sensitivity to touch, a red rash that begins a few days after the pain, fluid-filled blisters that break open and crust over, and itching. Some people also experience fever, headache, sensitivity to light, and or tiredness. For the vaccine, who can get it is any adult over the age of 50. And this definitely reduces your risk by 90 to 97% by just getting vaccinated. I do want to mention that, as you may see in the image, it says Shingles. This is the newest vaccine. Some patients have gotten the Zostavax vaccine, and if by any chance you need to wait at least 8 weeks before getting the Shingles, and that one, the coverage is not as good as the newer one. So it's better that you go to your local pharmacist or doctor and see when is the best time for you to get the newer one. Now, this is just going to be 2 doses. Again, it's not going to be yearly. You take the first shot and then you wait 2 to 6 months and then you get the second shot. All right, so this is where our presentation ends. We welcome any questions, concerns, or comments. Our phone number is right here and our open hours as well. Thank you for your time. We truly appreciate it.